Good evening, one and all. We thank each and everyone for joining us today again, the day 3 of National Nutrition Week Awareness Campaign. So thank you so much. There's a lot of hangama going on around my community. People are singing, dancing, lot of performances happening. Most of the emergencies they are doing tomorrow. It's all happening time. I still thank you all because you really valued us and you really valued our services and you're here taking out your time out of this busyness. So welcome one and all to the today's session. So today we have a guest of honor. Let me introduce her to you. So,
is it live stream?
Okay, can everybody please mute? Let's have certain basic rules, guys. Please mute yourself. If you have something to say, use the chat box. And when the Q&A comes, you all can unmute and talk to us one after the other. But I request you all to kindly mute yourself so that this session goes smoothly. Neja, can you make sure the YouTube live streaming has started? Can you just confirm once?
Live, ma'am.
Yeah, thank you. So today we have our holistic coach Padma here. So Padma, welcome to the session. Thank you for being here today for us. So let me introduce Padma to you all. So on this awareness campaign, on the day 3 of our program, we welcome a guest speaker of the day, Padma Kathi from Ahmedabad. Okay, she has done her master's in foods and nutrition and has over 11 years of experience. Apart from being a dietitian and a holistic nutrition coach, she is a certified yoga instructor and a meditation teacher. She has a keen interest in food and different flavors. She is passionate about nutritional therapies and lifestyle interventions when dealing with diabetes, obesity, hormonal imbalances, and child nutrition care. And let me tell you about her mission. Her mission is to help others to take control of their healing and live life on their terms. Her mantra is to be physically, mentally, and spiritually healthy to lead a happy and successful life. So this is about our speaker today. So we welcome officially to the session Padma, and thank you for being here. And coming to the topic of the day. So what is the topic of the day? You all are aware. It's the most happening topic. It's a world leader among the disease burden. Whether you take USA or India, you get to hear who is the world leader of disease burden. Everybody is aware. Diabetes, diabetes, diabetes. So today's topic is all about diabetes and what is happening around, why all these things are happening, what can we do to handle it better. We will hear through Padma. So Padma, welcome you again.
Thank you so much, madam. Such a warm welcome and good evening, one and all. Today we are going to discuss about the diabetes. Means not only diabetes, we are going to briefly discuss about the diabetic remission. Why we are calling this a diabetic remission?
Okay, that's my question. Actually, I wanted to start with that. Thanks, you raised that point because we put it across everywhere like it is all about diabetes remission. So, probably, can you explain our audience what is this remission is all about?
Yes, Jyothi. Thank you so much. And first of all of you know that diabetes care needs more than drugs. Means that care is the more than drugs, and this is the integrated to one person like mind, body, and spirit in the healing process. Not only medical approach, not only one another approach. This is the whole body, mind, and spirit approach. And here we are going to what is the diabetic remission. Diabetic remission means that our blood glucose levels blood glucose levels are going to below in diabetics range, and usually we thought we are using are taking any diabetic medication. In medical terminology, when we are tested, our HbA1c levels are below 6.0. And without taking any medication, that is called the diabetic remission. And when we are listening this one, how this will be looks like when they are hearing, like they can feel fairy tale. This is a remission and diabetic reversal, but this is a really happening. Means that magic is in what you do. This is my mantra in diabetes.
Okay. So thanks for that. So as we are discussing about this, let's discuss the benefits of having this remission in life too.
Yes, Jyothi. Because when we are going to take this decision, as I want to be diabetic remission and I want to go to the diabetic reversible process. So all of you know that diabetes is first they can start as a small seed like that, but they can cause so many complications later in life. So when we are going to take this decision and we are following, we are going to that program diabetic remission, we can reduce the long-term complications like heart disease, eye disease, kidney disease, and we can improve the physical and emotional well-being. Most of the important is that pain when diabetic patient is taking that medication or insulin, or maybe they are feeling like I'm a diabetic. Okay, that will be improved like a physical and emotional well-being, and no requirement for diabetes medication, and which can have important medical lifestyle and also last one financial advantage also.
I really love. I hope the last one is more exciting for people because we all love investing in things like be it real estate or be it insurance plans. Whatever gives us multiple folds of benefit, we all love to do that, right? So health is also not an expenditure; it is an investment, so that you save a lot for yourself. So wonderful, Padma. So having said that, okay, then how can we achieve this? What can we do uh, to have this achievement in everybody's life?
Yes, man, this is the like a tricky question. As they am before 2 years back, I am practicing as a clinical dietitian. That time my approach is different. Now I am totally practicing as a holistic nutrition coach. Now my approach is different. Means we are make 4 pillars of diabetic remission. And before that
Okay.
we are make the 3 pillars, but now we make the 4 pillars. So they can follow the must. What are that 4 pillars means? We before we are going to that, all of you know that diabetic would type 1, type 2, and gestational diabetes. Okay, how that will be insulin effect in our diabetes, lack of insulin, or maybe insulin resistant, or maybe in gestational diabetes. Means this is available in every area, like in social media, or maybe normal people also aware that. Okay, in 4 pillars, first of all, what I can take in 4 pillars, I can put first one is the emotional health. First pillar is the emotional health, and second one is the physical activity. Third one is the healthy eating habits, and fourth one is the weight loss. If we can need it, these are the 4 pillars.
Okay.
Okay,
Yeah,
and
please go ahead.
yes, yes. If we are going to the briefly discussion about why we are putting emotional health as in first pillar when we are going to diabetic remission, because this is the when patient is coming and we are giving as a normal dietitian or maybe clinical dietitian, we are going to their calorie count and maybe their lifestyle. Okay, we are looking some areas only. Okay, maybe some part of the stress, but we are not giving that much of time. When we are taking in history part as a holistic nutrition coach, we are taking as a 1.5 hour or 2 hours, maybe that is dependent on person to person, because what we have identified in that when person is emotionally psycho emotionally, they are in acceptance mode. Like if I am giving the diet plan or maybe I am giving the some interventions, but how much they are going to approach, means how they are ready to approach that thing, maybe any salary intake, maybe physical activity, or maybe any interventions. So if they are not ready to do, when we are going to emotional health, so we can identify the what is the cause of the cause and what are the thought process of the that client or maybe that patient. So then only we can give and we can analyze this. what are their trigger digestive system, or maybe how their body assuming his boss what is saying, what is sending constant signals, whether he was ready. Means we are respect to our patients thought process and flexibility also. That's why we are putting first one is the emotional health, and second one is the physical activity. Why I am saying physical activity? Nowadays, most people are aware about that means fancy available food items, or maybe available food items. So many they are going to millets, brown rice all together. In social media also, they are putting so much of knowledge, and they are gathering somewhere. They know that a food like means they can bring so many things in outside, but in according to physical activity they are sitting at home, or maybe they are doing something like physical activity 1 hour or half an hour. From whole day they are sitting like that. That's why we are putting second pillar physical activity. Not like that tomorrow you can go and walk a 1 hour, not like that. Whether they are lack in their routine, how they are flexible. And in physical activity, all of you know that how much benefit we can do. Because first of all, when we are going to physical activity, we are creating our happy hormones, right? When person is happy, and so that they feel amazing, what we can give other approaches they can ready to do because of their health. And second, okay, third one is the eating healthy diet. Eating healthy diet, why we are saying means all of you know that how they are taking means they are searching in Google, or maybe some people are aware or some people are not aware. But in our approach we are going to, this is the customized approach, uh, means person to person. In diet, all of you know that how we can take, mostly we are adding in complex carbohydrate and salad intake, limiting in sweets and sugars, limiting in high fat foods, eating high fiber. All of you know that this is the general thumb rules. Wherever we can go in a hospital as a consultation, or maybe in normal also, we can know that. But here is the, as a coach, we are giving the art of eating. Means how they can incorporate their day-to-day life. And fourth pillar is the weight loss. If that person means any diabetic person, diabetic patient carrying extra weight, obesity, some people are carrying around the fat in their waist or middle of the fat. So we can require up to, this is the research and our experiences were telling that 5 to 10% of weight loss means healthy fat loss also. They can reduce the risk of complications of high blood sugar, or also other comorbidities like high blood pressure or maybe high cholesterol levels altogether. These are the four pillars. In briefly, these are the main four pillars in diabetic remission or reversal.
Okay. Thank you, Padma. So, I'll going to brief this again for you guys. See, it's all what is more important. When we have diabetes, people think that, okay, your sugars are more, first reduce your weight. That's what your doctor says, right? But if you ask a holistic coach, she has put weight loss at the level 4, not at level 1. So what does it mean? What is more important? Or what is the immediate thing that we listen when someone has sugar or diabetes? Okay, don't eat sugar, don't have sugar in your tea or coffee, don't eat rice. These are the few things that we commonly hear. Okay, the food changes. And where's the food changes? It's the third priority. So why these two things are the third and fourth priority? What is more important is the emotional health. If a person is not emotionally ready, okay, I am really ready to do this, then only I'll get that adapting mentality to change to the given prescribed healthy habit routine. So unless otherwise that is not ready, whatever we might think and make little changes here and there, it's of no use. The sugar levels keep continuing like that, and all our lives keep continuing like that. So the point to be noted, guys, your emotional health is very, very important, followed by your active lifestyle. Then comes the food changes. The fourth is the weight loss. Why this is at fourth? Because once these three are done, weight loss happens automatically. That's the magic. Okay, having we discussed all the four things, then let us talk about the disease reversal thing these days, Padma. Like, we keep saying so many places, and we do also keep talking about the disease reversal. I want you all to talk to your audience, whether this is really a myth or whether it is really a fact.
I did not get you, Jyothi.
Okay. Is disease reversal possible? Is it a rumor or a fact?
Okay, you are asking me the impact. Okay, right. Jyoti, this is also very triggering question, and true should be there. Disease reversible is possible in one side, and one side if you are not taking any action and you are just thinking about the disease reversal, that is also myth. Okay, so when we are going to in action, disease reversible is possible with holistic approach. That is possible
Okay.
because we are approaching in different way. We are
Hmm.
finding the cause of the cause, means root cause, why that person is landed up the that place, means why he was victim, or maybe why he is diabetic, or maybe other chronic disease also, why they are landed in that place. So we can
Hmm.
find out the root cause. We are just not cutting the branches, like in we have allopathy or maybe other approaches. They have see the management of the disease. Management means pharmacotherapy also there, so many alternative therapies also there. They are just cutting up the branches, and that is the management, means that is also good when proper means medication, all that are important. But when we are going to diabetic reversal, means we know that this is the possible. In few 5 years back or 6 years back, that is the think that that is not possible, any disease reversal is not possible. But nowadays we know that disease reversal is possible because we are finding the roots. So cause, we can eliminate the cause. That's why disease reversible is possible.
Okay. Then let's talk about this. So, like people call upon for this 6 to 8 weeks programs or 3 months program. So um, let's enlighten our audience whether this period is enough for disease reversal or how it has to go actually.
Yes, so this is a very interesting question because so many patients are coming with me in programs also. They are doing 1 month, and means 6 to 8 weeks, and they get very good results. Okay, later they can think that this is enough for me. I got enough education or maybe enough knowledge, so I can stop the program, right? So they are stopping that, means they are stopping that they can get the in on paper they get the results also, because that is possible. But that is not a proper complete reversible program. Means in reversible, sustainability also very much very important. If we are going to fat diets or maybe calorie restriction, also we can get the result, means that is not a complete result, because there we are working only on one area, but here we are making new habits, new formation, and we are creating the new healthy choices. So it will take time. 6 to 8 weeks is not enough for diabetic reversal or any disease reversal, because
Okay.
sustainability are very much important.
Okay. Just in relation to what you have just said, there's a question from Shobna Sriram. I want you to answer that because it's totally related to what we are discussing right now. So she says, sugar after taking medicine, it came down from 7.4 to 6.4 now. So after the HbA1c is 6.4, what to do now?
So, madam, what is the duration of the time?
So Shobna, within what time you got this reduction? Okay. So as Shobna responds to this, so what we are
Um,
talking about is,
No, 1 year.
sorry,
It's 1 year.
it's 1 year, Padma.
it's very nice, madam. But how you can approach that one? How you can achieve that result? It's very nice. I mean, 7.4 to 6.4, something like that. So that is very good in 1 year. Okay. But what are other your parameters? Means like what is your psycho-emotional health, and I don't know your physical activity, or maybe what is your means whole history, right? You are seeing on the paper, this is the result. That is very nice to approach as a diabetes. But what you are following now, you can follow that, and this is the you can follow that to maintain the sustainability, right?
Okay. So Shobana says she's asking this for her mother, and Shobana, it's really a nice thing that you've really worked out with medicines. I hope there are certain lifestyle interventions too, along with the medication that you have been taking, so which might have resulted in this. And the tricky part is here. Once it is 6.4 on paper, as Padma is saying constantly, that is not all right, because it can go to 7.4 again in no time if we leave it there. So the important point to be noted is the consistency in doing the things. Whatever changes that you have made for the last 1 year, be it the food changes, or if there are any physical activity changes, or is there any kind of lifestyle changes that have been taken care, if they are, because we really don't know, but I'm just telling these are the possible things. If any changes were made in these three areas, they have to be continued for the rest of the life, so that your sugar levels will be maintained. That is the thing to be followed. And we are not stopping there, because this is nothing like we finished LKG, we go to UKG, done UKG, go to first class and leave UKG there. No, it will not happen like this. It is a everyday process. As we breathe in each minute, as we eat every day, taking care of your health is part of each single day.
True.
So, as we said this, now let's talk about the holistic approach, Padma, because since you're more into this holistic approach, and you being a meditation teacher, a yoga instructor, and you do a lot of sessions regarding all these things. So, what do you think? How this holistic approach is actually helpful in healing any disease or disorder?
Uh, Thank you so much, Jyothi, for putting this question. Because all of you nowadays listening as a holistic nutrition coach or maybe holistic health coach, but they don't know that what is the actual process of holistic nutrition coach and what is the approach. Okay, here we are going to see the all of you know that dietitians and doctors and maybe clinical dietitians, they are learn to how to read the disease, right? In holistic approach, we had to train how to read the person. Okay, entire person. We are reading the entire person as their from childhood to now where they are. Means that is a history taking, art of the history taking. And in this approach, we are going to entire person, not a tubular. Means we are not going to see the one approach like only disease in paper, HbA1c levels are this much and fasting is this much and all together. But we are seeing that person, what is the thought process? Okay, what is the thought process? And here we are helping that person not to depending on ourselves. We are empowering, enable that patient or client, they can heal themselves. This is the beauty of holistic approach.
Okay. Okay, wonderful. So, having said that, like we see a lot of disease burden increasing day by day. The world leader, diabetes, it's called the world leader. So, what do you think is the root cause for all this burden? Why people are actually getting into so much of diabetes? What could be the reason?
See, according to me, DCS means now we are seeing in every home, maybe two or one home, everybody in person, 1 or 2 persons have diabetes. And we are given beautiful name as a lifestyle disorders, all this. Okay. Because so many reasons, not a one reason. We can't find the one reason. Maybe environmental changes and food deficiency means how they are taking and their lifestyle. Main is the lifestyle. Means how we are taking previous food intake and now how we are taking. And previous how we are having physical activity, now how we can have the physical activity. Okay, not a, only one reason. So many reasons, stress and emotional health. Most of the important thing is emotional health, because now many families are nuclear families. So in from childhood they don't know how to means they are feeling any sad or maybe anger or maybe any feeling, but they don't know how to share that joyful moment or maybe the sad moment to other people. They are suppressing. This is the main coming in under root cause. This is not showing up that persons like this, like a physical activity, sedentary lifestyle, or maybe food intake, or maybe that thing. That are the risk factors. We are seeing that risk factors, but this is a different scenario in behind this scene. Okay, so they are not sharing anything, not only children like that. We also sometimes feel means lack of emptiness, means we are also not sharing, and so much of knowledge is available in everywhere, but we don't know how much we can take and how much we can release, and how much we don't need that information. Okay, all these are the factors, risk factors. One is the main important thing is lifestyle. In lifestyle, main thing is the physical activity, sleep, stress, and nowadays we can look that everybody is sleeping at least 12 to 12:30 in children also, and who, nobody will maintaining the circadian rhythm. Okay, and normal daily rituals. I means all these are, we knows that our mother father is maintaining all these, means they can early wake up, going to early bed, that is the biggest thing, and early dinner at least 7:30 to 8:30. So nowadays they are going to these looks like a small things, but these are the constantly they are doing, not a 1 year, 2 year, 3 years, maybe 10 years, 15 years, maybe 1 year, 2 year, like that. So this is the main lifestyle risk factors in physical approach, where we are seeing in physical approach. But in
Okay.
holistic approach, that is the defensive.
Nice, wonderful. So, guys, you heard from Padma, right? What is the real reason? If you really want to practically check on this, I'm going to give you all one assignment. So, if you all your grandparents, in-laws, who are elderly people, 60 plus or 70 plus at home, go talk to them, get to know their stories, learn from them how they used to live, what they used to do, how they used to go to school or to college, what kind of work they used to do at home, how is the system at those days, understand how they have been, so that you understand better how we are now. That's what bridges the gap and helps you to overcome these obstacles and come back and get back into a healthy and habituated lifestyle. Okay, so guys, if you have any questions so far, keep dropping in the chat box. We'll take it at end of the session. So now I've done an interesting activity, Padma. I've connected with several dietitians, a chain of dietitians across, and I asked them, what are the top 5 myths that you come across as far as diabetes is concerned in your own practice? These are all the real myths that come from patients to the practicing dietitians, and out of all the concerns they bring on to the healthcare professionals, what are the top 5 myths? So I have a list in front of you. I'm going to ask you one after the other, and let's discuss these myths. Guys, it's going to be more interesting and it's going to answer many of your doubts. But if you still have any queries, keep dropping in the chat box. So the first myth that I got to know is the most common is we will cut out carbohydrates, fruits, and sugars, and can we reverse diabetes?
This is a very interesting and common concern in diabetes. Okay, maybe here dietitians also there, our coaches also there, and outsiders also there. This is the like when we are seeing some things like looking like a fact, and we are looking something like that, that is looks like a myth, because when we are cutting carbs, means sugar, fruits, that is helpful in diabetic reversal, right? You are asking, Kathi?
Yes.
Yes. Okay. So here, one thing I want to ask: how many of you going to take chocolates, or maybe in Gujarat they are having kakra or chowda or biscuit with tea, and how many of you having this routine daily, and how many of you having daily whole fruit in your day-to-day life?
Come on, guys, type in the chat box how many of you have a fruit as part of your meal every day, or how many of you indulge on having chocolates or sweets as part of your day. Fruit, okay. Come on, guys, we need more answers. And guys, rest of your please mute. There is a lot of ambience noise. Please mute yourself. Yeah. So occasionally, SS says occasionally, someone says fruit and salad. Risha says fruit daily. Okay. We have 53 people in the room. I need more answers, guys. Come on, type quickly. Mostly fruit, daily fruit. Okay, daily what? You have to type, guys. Is it a sweet or fruit? Type your choice. Both fruits and biscuits daily. Okay. Okay. Here we go, Padma. Let's answer.
Yes. Most of the people, I hope, write daily fruit. Wow, this is a very good approach. If you are having daily fruit, but we are not seeing the hidden sugars. Like day to daily life, we are having so many outside means now that is available in packet foods. Okay. Like simple form is the biscuits or anything, but in hidden every packet when we are seeing that backside, normal people they don't know the what are the hidden sugars like corn syrup or maple syrup. All that are the artificial sugars. Okay, they can affect the diabetic, which can fluctuate your blood sugar levels. But when you are having that fruit, carbs, sugar in natural form, that will help to in diabetics, not a reversal but maintaining, that will not fluctuate your blood sugar levels, right? And when you are having the whole fruits or maybe whole grains, whole pulses, they can give the vitamins, minerals with high fiber also, very quality protein and fat also. So that is not causing that are not the root or maybe cause of the your diabetes. Okay, but that will be helpful in your day to day routine, because that will contain a good amount of fiber also and natural vitamin, minerals, natural sugars that will help in diabetic reversal.
Okay. So the bottom line is, guys, as we play hide and seek when we are little kids, the sugar also exists in many products, similarly in the hide and seek form. You never get to know whether that is sugar or not because it exists in various forms. It could be sugar, glucose, sucrose, fructose, maltodextrose, high fructose, corn syrup. All these are various forms of sugar, and they all are simple sugars. Means the moment we take them, it gets automatically converted into glucose. There is nothing else to be done. Whereas if you stick to complex carbohydrates, which are natural and which are whole, then it takes some time for the body to digest, absorb, assimilate, and get reached to the body. So they are good for our health. So the bottom line here is carbohydrates are very, very important, but the right type of carbohydrates one should take. So avoid the simple sugars and indulge on more complex carbs.
Yes.
And so
And also, I want to add one point here. You see what happening
okay.
in carbs means some people are having 4 to 5 chapatis or maybe a big bowl of rice only. Okay, they can have little bit of curry, okay, sabji, and no dal, maybe no salad, nothing like that. But next day they can have only dal with rice, or maybe they can take only 2 rotis and with dal, no other curries. Means they are not balancing their meal. Here is the moderate and balance is the important. Means everything is important in meal. Like 5 types: vitamin, mineral, carb, protein, and fat. Everything is important. In normal language, sabji, roti, or rice, dal, curd, and water also very much important in our day-to-day life.
So that's an interesting point. It's not only what you're eating, guys, it's how do you eat. The proportion of your meal plate is important. So again, the assignment what has given to you, the task which you all have to do, go and ask your grandmother or grandfather how they used to eat. They used to walk kilometers of distance barefoot, and they used to do all the things by themselves. There are no labor saving devices in those days. There are no maid services in those days. Coming back to our area, we have everything switch apart. Just put a switch and our works are done. But still, the milk practices remain the same. As we can change so much and evolve as per the technology, So why we won't evolve as per the food habits that are required for today's need? That is the need of the hour and the question to be raised by each of us. So the meal plate, it has to be proportionate. How much ever sabji or dal you take or curd, equal proportion of rice or roti. So that is your takeaway message for today. So try to get your meal plates. Drop us your meal plate photos tomorrow in the group. Padma will check it out and tell how healthy it is going to be. Okay, this is another task for you all. So the second myth that I've got from the chain of dietitians is, it's a very interesting one. But just doing fasting, can we reverse diabetes?
Yes, this is also very interesting question because nowadays so many are doing fasting. Means in fasting also not a like Ekadashi fasting or Chaturthi fasting or maybe any festival fasting, but doing the intermittent fasting. Okay, we are not saying that fasting is correct or not correct, and that is how helpful in diabetic reversal. Okay, if we are doing in proper way, means like in with your health coach or with your doctor or maybe dietitian nutritionist, you are doing in right way, because in fasting also this is the traditional method, not now, they are not invented now, right? We are giving the some rest about our pancreas, means at least 10 to 12 hours. In normally in before olden days, they are normally giving the 12 to 14 hours of rest, whole night rest to them. But nowadays they are having like that 9 o'clock dinner, and last going to before going to bed also they can having something like milk or maybe other any things. Okay, we are not giving to proper rest to our digestive system. Okay, but in this one this habit sometimes we are incorporate with who are not following exact this one, we are adding as a fasting like 10 to 12 hours you can't eat, like after dinner you can't take anything, no, next day to morning, that's it. Okay, and this fasting is helpful to rejuvenate your body, not in diabetic reversal, but that will help to in rejuvenate your body. And that is also when you are doing in correct consistency and correct, not every day you are doing 1 month 2 months or maybe that is like one day 14 one day 16 or maybe one day whole day 2 days like that, that is not important, and that will be cause the long term effect is nutritional deficiency.
Yeah. So this takes back to me an incident which happened a few years back. When I was doing my aerobics class, a girl has done intermittent fasting. Means she has really done a tough fasting for 16 hours, and early morning 5 o'clock she joined the session. This happened way back, guys. But she just collapsed because see, even the kind of fasting one is going to indulge, and the technique is one side, and the other side, how eligible are you to do this? What is your existing current nutritional status? Are you able to take that thing or not is equally important. So these things are not generalized. So it's very important to self check and get an advice and then do it, professional advice. So in relation to this, there's a question I just saw. 1 second. Yeah, it's again from Shobana. She says, for sugar patients, it is necessary to eat every 3 hours, means how the gut will digest. So is fasting good for diabetic? That's what her question is. Related to what we are discussing right now, so we'll cover up this point.
Mm. And this is the Shobhana, this is the individual approach. Not everybody needs to every 3 hours go and eat. Not like that. Every person have their own digestive system and own digestive trigger. Some people they can have means 4 to 5 hours gap also. They can feel very light and energetic. Means we can just listen to our stomach, our gut only. Not like that every person is eating 2 2 hours. If I am a diabetic patient, I can eat 2 2 hours. Not like that. This is a personal approach. Listen to your gut first, and what you are having other comorbidities, that is also in intermittent fasting or maybe any other thing. That's why this is the personal approach is very much important.
And just I want to add on a point more here, Padma. Like along with this, it's very important, like what you are eating every 3 hours. Guys, whenever we say every 3 hours, it has to be a small and frequent meals. It has to be a small and frequent meal. So we can't eat a plate full of meal every 3 hours. Then obviously the gut won't be able to handle. So it has to be a short and frequent meal. And this way, we are actually making the body activate and work and function it also the day, provided we are eating the right type of food. Point to be noted. So we will go to the third myth that I have come across from professionals. Okay, the third myth is many think that they won't be able to reduce their medicines or get off the medicines because they have a family history of diabetes. So if a person has a strong family history of diabetes, even if they follow all the interventions that are given, will they be able to get off the medicines or not is their doubt. Can we talk about this, Padma?
Yes, sure. Here we are, here also, this is also individual approach, and why they are carrying like that, that type of belief system. Here that patient has certain belief system, means in my family or maybe my genes are, means that are causing that my diabetic situation, or maybe where I am now as a diabetic patient. That is the reason. One of the reason is my genes or maybe my family history. No, not like that. If you are doing consistency, your program or consistency, you are following your lifestyle interventions, and what is your thought process? Why you are means as a coach, we are seeing the what is your belief system. Okay, when we can newly create our belief system, this is the myth, means genes are not only 10 to 20% that will trigger, but that is also in your hand. What is your thought process? If you are doing the free will, I want to get rid of, means I want come this in diabetic remission, so that is possible to you. Means that diabetic medication is gradually get rid of, and you are going to complete diabetic remission. That is not depending on family history.
Absolutely. Thank you for the input. So it's totally your life, the way you live, guys. Nothing. Please don't unnecessarily blame the family histories because it has no role to play. It's purely on how you are going to lead your life. Is God going to decide what you are today? So, having said that, the next question is something related to this, but a little twisted. Like, if people are already on insulin or medicines of diabetic medication, I will never be able to come out of it. Is again like earlier it is related to family history. Now they think already we started taking the medication or insulin since we have diabetes, and will I be actually come out of it, or they believe that they have to take it on for a lifelong. So what is your say on this?
Yes, in this, if they are a type 2 diabetic, they are comes under in insulin. Like I have one patient in last year. He was in 40 units of insulin, type 2 diabetic, but last 5 years was having 40 units of insulin, and two times tablets, morning two oral medication, and night also two oral medications. But when we have started the program, gradually we can reduce the insulin doses. Okay, after 4 months, not a 3 months, 4 months, he was get rid of his insulin completely. And he was in one tablet now. Now also after 1.5 years also, he was in one tablet. Means that is possible. But that is the depend on person to person. How we are, means this is a 50-50% coach and as a diabetic patient. Otherwise, they are following their themselves also. Depend on yourself, means how you are following consistency, and what is your approach, normal approach, yeah, holistic approach, that all together. But it is possible to get rid of the insulin and reduce the insulin and go to the medication and get rid of the medication also.
Yeah. So, guys, the takeaway message is it's very much possible. The good news, but provided there are a lot of things, a lot of hard work has to go in. It's your lifestyle, your food changes, your physical activity, your emotional health, your mental health. There's so many things that are part and parcel of this particular package, which when happen all together, when the 7 areas of life we call it actually. So, or stress free, and we accept everything as it is and do the things that are really needed, then along with all these things, it is possible. So, the last myth that I've got is type 1 diabetes reversible?
Yes, this is also so many patients means when we are dealing with type 1, type 2 diabetic patients also coming. But in type 1 diabetic, we can reduce the insulin doses. In 3 years back, I'm dealing with one type 1 diabetic patient. She is also doctor, MBBS doctor. She has come to be like 80 units whole day, 80 units of insulin. But when she can come and gradually we are going to this approach, means not a, that time I'm not a holistic nutrition coach, in clinical dietitian only, but we can approach the all things. So we can gradually reduce the insulin doses up to she is now maintaining in 18 units. But she is now, how much she is free? Means they are not carrying their, I am the type 1 diabetic, my insulin, that pain. She is not carrying anything. She is happily enjoying her life, like she's eating everything, she's doing her physical activity, and she is enjoying everyday day-to-day life. This is the change before and after, right?
So, yeah, absolutely. If you all remember, guys, first day I was talking about a particular case study of a tribal girl. You all remember from the Nilgiris? I was mentioning the same thing, like 80 units of insulin. That girl has reduced her insulin dosage to 50 units with just little bit of lifestyle intervention. And she's a tribal girl. Imagine if we are here knowing many things, have the overload of information all around with all the services and facilities, why it's not feasible. So it's very much possible. So again, the bottom line is here, type 1 diabetes is not reversible, but we can definitely reduce the dosage of insulin. Thank you, Padma, so much. That's a wonderful discussion we had today. So let's head to the Q&A. Let's see what we have the questions for today. Nirja, can we get the questions, please?
Can a diabetic person have tender coconut water daily?
You want to answer, Padma?
Yes, absolutely you can have, but with without guiltiness.
I love it. So, guys, when you select your coconut water, look for the one which has no coconut in it. You know, the tender coconut water doesn't taste sweet at all. It is a bit of different taste. It's rich in electrolyte. That water is okay. But the one which full of coconut, which is sweeter, don't take that. Tender means really it has to be tender. Yeah. Point to be noted, without the guilt that this will affect you, or put your right thought to it and have it, it will not do anything. Okay,
Yes,
Revati.
because this is also personal approach. So many things comes in.
Yeah. And please, guys, when it comes to your disease management, please don't ask whether one food does any job or not. It's so difficult to say. You know, it depends on so many factors. We have discussed so many things so far. So we cannot simply say whether this can be done or not. It's so difficult. We can just say a general thing, but it might be applicable to you or might not applicable to you. So have a check on that. So Revati, you want to say something? You're raising your hand.
Yes, Jyothi, thank you so much. And Padma, that was a wonderful session. Thank you so much for those information. So my one question is, generally, I used to get these kind of questions from the diabetic line. So what's your call on sweets made of artificial sweetness?
Okay, my favorite question.
Yeah, so because many of the patients, they feel like artificial sweetness, sweets are better, and that doesn't raise the sugar. I just want to want you to throw some light on it.
Yes, Revati, definitely. Because in artificial sugars also, they are bombarding like that. These are the natural ones, like, okay, natural sugars also, and 0 calorie, like that. But when we are going to now, like a diabetic patient, my advice is, don't go to the any artificial sweetness. Once upon a time, that is fine. because that is also having certain limit, no, 0.5 mg like that per day. But when you are going to get it after that artificial sweetness, you are so many people are thinking like that. This is a 0 calorie, so my blood sugar levels are not raised up. But the taste also, I tasted that also. How this will be there, like artificial sugar. When they are having, na, they can't feel anything. Just they are satisfying themselves. We are putting these artificial sugars. And in artificial sugars also, we have so many companies like Sartal, Zizal, like that. Okay, we can choose wisely. In this also, we can choose wisely. And that is also not regular use. We can use once in a while, that is fine.
Yeah. And one more point to add on top of what Padma has said is, see guys, adding a sachet of artificial sweetener to your cup of tea or coffee is fine because we have recommendations for that too. But whereas when making a sweet where we use 1 kg of sugar to replace that 1 kg of sugar, how much artificial sweetener are you going to use? Have you ever thought of that? It's huge. So a big no to all these things. Definitely
Yes.
not.
And if we are using 1 teaspoon of our regular sugar, but you can see the whole day, how much indirectly you are adding the sugars, hidden sugars.
And along with that, if these are not natural sweeteners, you are loading up your body with lots of chemicals. Please don't forget that. So a strict no from our end, definitely to anyone. Okay. So hope that answered you, Revati. So coming up, questions, Revati. Sorry, Nirja. Can we have the next one, please? Okay. Okay, let's take this from Hafsa. Hafsa says, Hyderabad is the capital city for diabetes. What would you want to say about the diet Hyderabadis have every day? So let's hear from a Ahmedabad lady who wants to talk about Hyderabad diet. Come on, Padma.
I'm staying here Ahmedabad, but my native is Hyderabad only.
I know. I'm just kidding, Padma.
Yes, yes. Because here in Hyderabad is Ahmedabad is maybe in another place, we can't stick one type of diet. First, we can go to that religious place. What they are having the staple food means every family have different family history means eating habits. Okay, every region have different regional like food habits. So go to the and observe that things. Not a special meal stick like you can have salad means I'm saying that salad you can take this salad or maybe chapati or maybe anything. In North India they are taking chapati. In South we are having the rice. Okay, in here also I'm having the rice. This is the big difference because my digestive system, my thought process, and my memory is like link up to the rice only. So you can upside here also you can listen to in Hyderabadis. You are staying in Hyderabadis. Okay, you can observe that their lifestyle and what they are eating and what is their staple food. Yeah.
and to add that, Hafsa, if you want to talk about us on Halim and double kamita, obviously it's a big no. A diet has to be balanced if you really want to have the diabetes in control and manageable and reversible. So we have one more question from Shobna. She says, my mother is diabetic and also suffering from sinus problems. What can we have to reduce so that she can sleep? Uh, Shobna, before even Padma answers, I want to put it like these are very, very specific questions. We won't be able to do much help to you, but we will enlighten a little bit, but you have to get in touch. Yeah, Padma, would you like to talk on this?
No,
Sinus problems? No. So
no.
it's an
This is
in-depth
a
question. We have
personal,
to,
yes.
yeah. So unless otherwise we know the person, as Padma have been telling, it's not the disease that we study the person. So unless otherwise we know the person, these kind of questions become a little bit difficult to answer because we won't be able to do justice, you know.
Ma'am, one
So
interesting question, ma'am.
yeah,
Diabetes always leads to blindness and amputation and also kidney problems.
Okay, can you repeat, Nirja?
Diabetes always leads to blindness and amputation or kidney problems.
Okay. Padma, would you like to take it?
See here, every diabetic patient don't have any means same complications and same comorbidities. So don't think like that. Every person means some person have the amputation or maybe kidney failure or anything. So I am landed up that one. But you can focus on yourself. Who was the diabetic patient? Now what is my situation? Okay. So if you are thinking like that, you can take care of yourself. Like you can modify your lifestyle. And when our blood sugar levels are normal range, we are in healthy range. So that is fine. They can't cause the other comorbidities like other complications. You can keep on checking your blood sugar levels are under normal range or not, and other factors also. But you don't think like that. Every person have the same complications.
It's something like each kid who goes to school will get a beating from the teacher. No, right? They get education. Similarly, everybody who has diabetes will not go to amputation and loss of eyesight and all. It's just a lifestyle disorder, guys, and it has just came into our life because of faulty habits. So just once they are corrected, it's very much feasible to get back them in place. So I think we are more or less done with the question. There's one more question from Hafsa. She says, late night functions, but the question is not complete. How diabetics should manage late night functions might be the question.
That is also comes under lifestyle interventions also. And why they are choosing that much of late night functions. Behavior change.
See,
Okay.
so see, guys, if you really don't want to keep up your cravings and indulge in whatever you see when you get a spread of food across late nights, the suggestion would be have something at home and go, so that your tummy will not crave for everything that you actually see around. When you have a fruit or something at home and start and go to a function, your tummy is settled down because it already got a bit of what it needs. Then the cravings will come down. Then make some mindful choices. Out of the whole spread of food, though it's a free food, we have to make use our own free will to choose the right food. That's we call mindful eating. If you get a cream center cream stone stall next to you and a mirchi bhaji stall the other side, and if you see a fruit and salad carving in front of you, what you should choose? It's always good to have a little helping of sweet or ice cream, nothing wrong. But preferences and the proportion of what we eat is important. So Samata is raising her hand. Samata, you want to ask something?
Yes,
Jyothi,
ma'am.
madam,
Good
in
evening.
this question, I want to add, sorry,
One
Samita.
second, Samata. Yeah, please,
Sure.
Padma, go ahead.
Yes, here also we have choices, Hafsa. What Jyothi madam says, na, we can have choices before going to, means what we are doing, means once in a while we are enjoying the party, that is right. Our choice also, and that is our right also, that type. But if you are going to frequent, or maybe we are suggesting one client, so we can give the healthy options like that. Before going to party, they can have what Jyothi madam says, salad, simply salad, or one fruit, or maybe in healthy choices. And in that, there also we can make so many choices. When you are observing, na, so many healthy choices will be there, and other things also there. So you can fill with first healthy choices, then enjoy with your other one.
Yeah. And I can add on one more tip. This I've learned from our mentor, Dr. Suresh Kumar. So this is a very, very good trick. If you really implement, you will get good results. So whenever it's a meal, people usually start with soups and starters, then they go and indulge on everything, then they'll come back to the rest of the desserts and all. So when you go to a spread of menu, go start with curd rice first. Eat your piece of curd rice, then come in a reverse order. Eat whatever you want, but come in a reverse order. And let's see what happens. And come back to us and tell us your story. Yes, Samata. Next, it's your turn.
Yeah. So, ma'am, how should be the support of the family for a person with a higher type 1 diabetes? Matlab, they also have to make some changes so that they are not, separated. how should be the support? Like, they take it like, at least at the home. See, office, somewhere else it is okay. But at home, how should be the support of the environment?
What kind of support you're looking for, Samta?
And the related to diet only, ma'am. Should the entire family make certain changes, or we'll focus on, because see what I'm randomly I just wanted to ask you something.
No, this is a very important question, and I have a very, very good question also.
Because why I'm saying, Dr. Jyothi Garu, the primary caretaker, whoever cooks the food, matlab separate. It should start from them, not just the person, but also the family support. So how do we take care? Like, any counseling for the entire family we should take into the picture, or how should we go about it?
Okay. So to put the question in short, for the diabetic, should we cook separately, or if not, how to manage? How the stress has to be handled by the person who's handling the kitchen. Padma, would you like to answer, or you want me to go about?
Just I can give response. You can elaborate it. Okay, here we don't need to any separate cooking, Samantha, because I don't know. Maybe you are observed some person in your relatives or maybe near to dear. That's why you are asking. Here, what is the support? Main thing is the emotional support. So when we are taking the counseling, if parents and mother, father also there, that is very benefit to that person. Okay, and here we are not separating, means we are giving the small interventions only. Not like that they are preparing one cooking one meal and family members are cooking, not like that. What is available at your home, that is the coach work. What is available at your home, we are seeing all together now what is your religion and how is your situation. So according to that only we can give that plan. So in this, family health is very much important, especially for mother.
Yeah, because see, now why I'm asking is, in a family we have people of different age groups, like kids. For them who taking fruits or chocolates, and also a newly diagnosed type 1 diabetic patient. So in that, that critical time, I'm just asking that way. Like, for somebody who is been like chronic, like they get used to. So that's all.
They will never get used to, Samata, be it acute or chronic or newly diagnosed or long term. It is a burden for any person. See, the simple rule to note is, we as a holistic coaches, if you ask our approach, we'll study the person. Why do we study the person? If I study the person, it's not only the person, it's the entire family, their habits and their living style. So when the recommendation is given, it is for the entire family. Though you paid for a single patient and take the advice is applicable to everybody in the family. So there's this question of challenge of why and how to handle and cook separately for a diabetic person or any other disease person never comes across actually. Because food habits and the lifestyle remain same for everybody. We are not giving any fad diets and we don't suggest any. And there are no quick fixes. Whatever lifestyle you have, we will identify the gaps and we'll fill them. Since we do this, it's very easy for the entire family to get into this and follow the quick routine and fall into the healthy habits. So there is no separate cooking needed, be it kids, be it old age people, or be it anyone. So guys, I'm so sorry. I have to interrupt here. I didn't realize that time. It's already past 6 minutes we crossed. So thank you so much for having us here. The rest of the questions, if you have any, please go to the YouTube link and post in the comment section. Padma will come there and answer all your queries if you have any more. And our coach Sirisha has shared an interest form in the chat box. Sirisha, can you please reshare? Those who want to get in touch and take an advice and really want to connect with us, please click on this link and register with us. Just we need your name and phone number, nothing much. It takes only 5 seconds for you to get registered. But if you fill the form, we'll get back to you after the campaign to help you better. So thank you, Padma. It's really a wonderful session, and thank you so much for being here today and you for enlightening all our members. And I thank all the participants of today's session in the live YouTube and also here in the Zoom. And we'll see you all tomorrow for a very interesting topic, which is thyroid. Don't miss out. Bye bye, guys. Good
Thank
night.
you, ma'am. Good night, ma'am. Thank you.
Thank you so much, Jyothi, for giving this opportunity.
Yeah, it's our pleasure, Padma. Nija, can we close the session on the live streaming, please?